There are a lot of myths about scleroderma and skincare and a lot of autoimmune diseases in general. Once you're diagnosed with scleroderma, people hit the internet and they read things and they see incurable. But it's important not to panic because there's so much that you can do ahead of time so that you're in control of the disease and the disease is not in control of you. People living with scleroderma, especially the systemic kind, the kind that goes both outside and inside, can have problems with both digestion as well as incontinence. As you eat and digest your food, it's moving along according to smooth muscle in your gut. And what happens with scleroderma is you get a buildup of connective tissue as well as a problem sometimes with narrowing. And if you think of a narrowing in a pipe, what happens is the fluid builds up on one side of that pipe and then there's just a tiny little hole for it to try to get through. Well, what your body does is pull more fluid into that area before that narrowing and try to push it through so that what gets through is really watery. And so it can be very common to have frequent diarrhea, stools, and then it can affect your sphincter muscles, your ability to hold things, because that too is a muscle. And so if you get problems with scleroderma up high or down low, it can cause problems with diarrhea and then controlling the diarrhea if you should get it. Skin breakdown can occur with incontinence for several different reasons. One reason can be the consistency of the stool, that if it's really watery and it's high in enzymes, those digestive enzymes are great inside when you're trying to break apart your food. But it's not good when it hits your skin because their job is to digest, is to break things apart. And they see your skin and think, oh, this is really good. I can take this all apart and destroy it. And you don't want it destroyed, obviously. So having diarrhea and the particular pH of the stool can cause breakdown, plus the frequency. If you go a lot and it's really watery, you're wiping that area, and if you're using something that has a lot of friction or is irritating, that's going to make a bad situation worse and can really set you up for more skin breakdown. The gold standard for skincare is actually one that was established by the Wound Ostomy Continence Nurses Society as well as the National Pressure Ulcer Advisory Panel. And it's a three-step process. It's not complicated, but it's very precise and it has evidence to back up what we're saying. And that is to cleanse well. And by cleansing well, it means using a pH balanced cleanser that is going to lift up the debris or clear away the urine or the stool, but not strip the skin. So it should be gentle and foaming to lift that up so it's taking away the bad stuff, but still leaving the skin good and intact and not using rubbing and friction to get it off. The next step is to protect it, because aging skin, and especially when you're incontinent, it's very, very fragile in that whole area down in the perineum. So you want to be sure to use a skin protectant that's designed for adults. So it's applied after the skin is thoroughly cleansed and patted dry, and then a thin layer is applied in the entire region, and that will allow the skin to be protected from stool or urine as they would have another episode during the day. And then finally, if there is a breakdown, you want to use a rash cream that is designed for adults. The baby products are great for babies, but they're not designed for adult skin. Adult skin is very different in terms of texture and pH than baby skin. So you want to use a zinc oxide based rash cream that has petrolatum in it, which will make it easier to remove. So it both protects, but it isn't going to dry on like a cake-like type of product.